Hey everybody, Dr. Brown, the CFS doc here. Today I wanted to give you my theory of what chronic fatigue syndrome is. Now granted, no one really knows. This is just my theory based off what research I've done and what I've seen in my own personal experience as a chronic fatigue syndrome patient and what I've seen in my clinical practice. I believe that chronic fatigue syndrome is probably, first and foremost, a disorder of the autonomic nervous system. And many of the symptoms and problems we see are downstream effects of that. Now, the autonomic nervous system is the part of your nervous system that controls the automatic processes in your body. It is the nervous system that helps keep your body in balance and handle stress, with stress being anything that would throw your body system out of balance. And I think the main reason that this system becomes dysfunctional is because the stress we experience is so much for so long that our stress response system, that autonomic nervous system, it can't handle it anymore. And it sort of puts up this hard stop to try and reduce the stress on our body so that it continues to keep us alive. Now, these stressors on the body system, they can be physical, and they often are, and they can be emotional, and they often are. Most of the people I see, and in my own personal experience, it's a bit of both. Examples of some physical stressors could be things like a viral illness, lack of intake of calories, possibly because of an eating disorder, or possibly because you're not absorbing nutrients well. For example, if you have untreated celiac disease, it could be inflammation in the body, perhaps from mold or toxin exposure. And some examples of emotional stressors, for me it was my medical training, medical school in particular. Could be complex PTSD or the situation that led to that diagnosis. Could be an abusive relationship, or a sense of not feeling safe. Any of these things, you would need your autonomic nervous system to help support you through these stressors. And if you have strong stressors, multiple stressors going on for a long amount of time, your autonomic nervous system will say, I can't do this forever. And it'll eventually send signals throughout your body that say, stop making so much energy. We need to prioritize staying alive. Prioritize central blood flow rather than blood flow to the extremities, to the arms and the legs, and then you get dizzy and lightheaded. You only have enough energy to do things that absolutely need to be done, things that are your body allows you to do through an adrenaline burst, but everything else falls by the wayside. And we as human beings, we tend not to take the hint. We tend to push as much as we can and hold on to what little bit of life we can. And that gets us into this push-crash cycle. We stay sick and we get sicker. Hope that makes sense to everybody. I'm happy to expand on that or answer any questions you may have. Put them down in the comments, like, subscribe, and I'll see you in the next one. Bye.